We're really excited about opening the new rooms for our cardiac intensive care unit. We'll be opening at the beginning of July, and the increased expansion will give us additional capacity to care for a lot more patients in our heart center. So we're going to go from a 24-bed cardiac intensive care unit to a 48-bed cardiac intensive care unit. And this will enable us to care for more patients with congenital heart disease that currently wind up at different places in our hospital. The advantages to this are that we as a heart center are able to have all the patients in one area so that they can have access to all of the different subspecialists that they need. The surgeons, the intensivists, the cath lab guys, and all the services that we provide to our kids with congenital heart disease. Currently, we occupy nearly capacity every day, and it's constant flux to try and figure out which patients can come into the cardiac intensive care unit and which patients we have to care for outside of the CVICU, providing services stretched across the hospital. This enables us to provide better services to our patients. Our growth over the past couple years has really led to this need for increased capacity. Both the population growth of Phoenix, in addition to our increased amount of services to different patients, one of those being adults with congenital heart disease. One of the biggest problems in congenital heart disease is actually our success. So the fact is now that there are more adults alive with congenital heart disease than there are children with congenital heart disease. And so what that means is that as these children grow into adults, they need places to get their care. And Phoenix Children's Hospital has taken the idea that we are going to be the medical home for these patients, and so we're providing increased services, and so we've structured our unit to reflect that. And so we have new lifts to help with patients moving around, as well as increased technology. One of the neat things that we're doing in our new ICU is that we have 2 monitors, so that if a patient is having an acute event, we can maneuver the different monitors around the room so that all the participants in an event can help and can see what's going on with the rhythms, what's going on with the pressures, and can help manage the patient. This enables the entire room to have a better understanding of the physiology that's going on with the patient and can help us to stabilize the patient. In addition, for children and adults who are needing an emergent procedure, we've added surgical lights to all of the new rooms, so that if a patient needs an emergency procedure, the surgeons can actually, we just close the room and the surgeons can operate in the room. And we can create an operating room here on the 5th floor to better serve those patients. There can be a lot happening in the transit time between the ICU and the operating room, and so if emergencies are needed and you need your team there, we can now better provide that service. One of the other real benefits to having all of these rooms on the same floor is it allows us a continuum of care. So currently, our patients are admitted to different places in the hospital and they go to surgery and they wind up in our cardiac ICU, but then before going home, they wind up in a different area of the hospital entirely. This will enable us to admit a patient to CVICU, go to the operating room, return to the CVICU, get their immediate post-operative care here. We will now have step-down rooms where a patient can then go to learn the medications, learning about going home when they don't quite need intensive care, but they're not ready to go home, but they're still within our floor and within our home. That way, if there is a step backwards or if there is a reason that they need to return to the ICU, we're just right across the hallway. And the resources and the people who are caring for the patient are all locally in the same place, which just will make communication much easier and the care much more streamlined. So we're very excited about the new ICU, but one of the other areas of excitement is that we've encouraged our families to give us input on how they'd like the rooms to be better designed. And so we've really taken to heart their ideas over having a family area, a private area, and we've taken into account some of those ideas. So this is going to be a better place for families. We've listened to the voices that have spent the weeks and the months here in the ICU, and we're trying to make it a better place for them.